My question is, and I'm going to ask you the same thing that I asked Ron Bailey, and since you have a history of seeing mental health up close and personal, are we getting better as a nation in helping people deal with mental health issues? Are you, I mean, I want to, and then has there been a different perception of mental health in Black families? We tend to think of it as something like, I think it's interesting that you said your grandmother was able to be in your home. Um, I know someone else whose daughter has it and she's not able to be in her home. She really has severe schizophrenia. We hear the dramatic stories in the papers where these people, schizophrenic patients, have lashed out violently. So that's a very interesting thing that you were able to experience a grandmother. I think that's precious. Um, so was there something different about her care versus now, and are we getting better with the mental health system?
I would definitely say we're getting better. So, I mean, just like with everything else, technology and advancements and all of that continue to occur and grow.
Mm-hmm.
Now, the thing about mental health is that, it's like if you do this, this, and this, we call that schizophrenia. We call this bipolar, this depression, and this anxiety. Realizing that when you're looking at schizophrenia, some would even say that you're seeing up to 8 different types of disorders that we're lumping into the framework of being schizophrenic. All right. So having a psychotic disorder with erratic behavior, confusion, and
Mm-hmm.
oddly enough, psychosis is thought to be a thought disorder, not something dealing with hallucinations, but a difficulty in the way you think and process information,
Mm-hmm.
even though the hallmark is hearing voices or bizarre behavior. So, so it could be very different from one person to another. I know I have patients who are schizophrenic who have to live in facilities in order to be safe to themselves and to others. And then I have other patients who are schizophrenic who are doctors, or who are accountants, or other Uber professionals, where their symptoms of schizophrenia are very controllable with medications. So when somebody tells me they're schizophrenic or I have to make that particular diagnosis, I really don't know the outcome on day one because you're hearing voices. Well, if you respond to the medication and you go back to a normal level of functioning, you look no different than anybody else. But when you're off your medications, within a week or two, they go back to being non-functional. So, that is schizophrenia. But then you also have those who can be violent or aggressive or
Mm-hmm.
very bizarre or who will stop
Disorganized thought.
eating. All of those issues can occur as well. And so it's really about really more so how severe the symptoms and what is your ability to respond to medication treatment.
Mm-hmm.
And so which is the ability to access services,
Mm-hmm.
the ability to have insurance, and the willingness of the individual to try to get better. Realizing that I do know people who do all that they can do, and they still struggle with this illness,
Mm-hmm.
despite accessing every resource that they have.
Mm-hmm.